Yeah.
And is it an OET like a speaking session or
Yeah,
just
this is speaking.
during the introductions and like
No, one by
before
one
3 minutes?
we are doing the entire speaking session. But you will be
Okay.
the patient, you will be the nurse, you will be everything. Everything you only make a
And
dialogue
is
like.
it an OET like a speaking session or
Yes, it is OET.
just
This is session.
during the
Yeah.
introductions and like
OET no, one by
before
one
3 minutes?
we are
One
doing the
second, hold
entire.
on.
Hold on 1 second. Hold on. Yeah. So we have started the online session here. Okay. Now this is the speaking session, Pilonidal Sinus. This is an OET role play. We are starting with the beginning. We are beginning with the introduction and closing with the conclusion. So step by step we will go. So okay.
Okay, sir.
Christoph, Sachin, is that
Yes, sir.
clear?
Yes, sir.
Smita is also there. Smita is also there. Okay. So all the regular students will be participating and others also will be participating, because I cannot force everyone. So I will not tell everyone, but whoever is interested, you can participate. No problem. So Christopher, now this is the role play card of the nurse. This is the role play card of the nurse. Now what you
Okay,
are
sir.
going to do is, you will introduce yourself. Like, see, Safura has already introduced here. Safura has introduced here. She said, hello, good morning. My name is Safuratu Al Hassan, and I am one of the nurses in this hospital. Please, how may I address you? She told like that one. Okay, like that one, I want you also to write your own sentence. First, you speak, then you write, or you first write, then you speak. Okay, one by one, I'll call you, then you will be speaking. You write in your notebook, then type here, then afterwards, I'll give you 3 options. First one is write in your notebook. Write in your notebook. What you want to speak, write in your notebook first. This is the first step, all of you. All of you. Yeah, next step is type in the chat box. Type in the chat box. Yeah, this is the second step. Number 3, speak in the audio. So this is, I will give you opening, then you can speak. Yeah, first one. So let's just start. Smita, you also can write your answer there. Okay. You also can write your answer there. Yeah. Safurato, your sentence is here. You said like this. Okay. This is your sentence. Okay. So that's very clear. Yeah. I am showing you. Yeah. Everyone's. So this is Safurato. Okay. Safuratu Al Hassan. Yeah, this is Safuratu Al Hassan. So this is your first sentence. This is your interest. This is your introduction. This is nurse. So you have spoken as a nurse. Very good. You can improve this one actually. There are some mistakes. Okay, nice. Now, the next one. Yeah, what about the others? This is Safuratu's. Right. Then next one. Who will do? Come on. Everyone will be given full discussion. Smita, you also write your sentence. Yeah. So now I'll correct your sentence, Safuratu. Hello. When you say hello, no need of good morning. When you say hello, no need of good morning. When you say good morning, no need of hello. But hello is informal. Good morning is formal. So try to use formal style. Try to use formal style. Okay, we'll take everything, then afterwards. See, this is your sentence. No full stop, no comma. Everything type properly and give me, so that afterwards we can discuss this one. So in the same way, yeah. Now nurse is over. Now the patient. So the patient. Now patient's next. So what will the patient speak? Here is the patient. Okay. So you have to think about both these things. You have to think about both these things. 1 minute. Shailu. Shailu. बन गया? हाँ, रेडी है? वेरी गुड, वेरी गुड. ओके. सो ठीक है, ओके. ठीक है, ठीक है, ओके. ओके. ओके, ठीक है. मैं इधर ही हूँ अभी. मैं इधर ही हूँ. हाँ, ओके. हाँ, ओके, मैं इधर ही हूँ. ओके, ठीक है. Yeah. Yes. So now nurse, come on. This is nurse role play card. All of you write. So this is Christopher's speaking session. So I am making everyone's dialogue. Okay. Okay. This is Christopher's. This is Sachin. Christopher. Okay. I'll give everything there. This is Sachin Christopher. Yeah. So now Sachin Christopher. This is nurse. This is nurse. Then next one, you have to speak as if a patient. So let everyone finish, then we'll go there. Then Smita, I'm waiting for your writing. Yeah. So I'll give you the full dialogue, all of you. We'll discuss all these mistakes, what you are doing. We'll know very clearly. Okay. So this is nurse. Yeah. So nurse. Yeah, here it is. Others also write down in the chat box. We are going to develop a powerful style now. See, others. So regular students will be writing like this. I will force them. They must write. But others, guess. If you are interested, you write. Otherwise, leave it. Al Jawahara. You can write your own sentence. Then Shilpa. If you are comfortable, you can write your sentences. Then Vinod Singh. If you are interested, you can write. Fine. Write your introduction. How you will introduce yourself to the patient. Yeah. So the best, those who write the best, they'll be given a special gift. Yeah. They will be given a special gift. Come on. Those who bring out a good quality sentences and good dialogue, they will be rewarded. Yes. So you can learn from the other sentences also. If Christopher has written very nicely, Safura, you can notice some sentences or vocabulary, you can use them. Yeah. So, yeah, nurse card. Yeah, this is Vinod Singh. Very good, Vinod Singh. Yeah, Lily, why are you not joining the class? You are a regular student, right? Come on, join. 1 minute, 1 minute. Are you busy? Okay, no problem. If you are busy, no problem. Afterwards, I'll take for you. Yeah. So these are the regular students. Smita. Yeah. So number 3 is Smita Kant, our regular student. Okay. So nurse. Yeah. So that's it. Yeah. So, right. Next one is patient. Now, what will the patient say you think? So, according to your question, what will the patient say you think? Okay, next one. So, Vinod is also participating. So, we'll give him another page. Yeah, this is Vinod Kambli. Huh? What is the name? Vinod Singh. Okay. Vinod Singh, do I know you? Vinod Singh, name sounds fine. I remember somewhere. Do I know you, Vinod Singh? Yeah. You all can follow this Smita. She prepares very nicely. Okay. Vinod Singh. Okay. So nurse. Yeah. Now patient. Now what will the patient speak? Okay, fine. Now patient. Okay. This is the patient. Come on, think what will the patient say? You write your own sentences. You write your own sentences. What will the patient speak? According, you are telling something, then what are you expecting the patient to speak regarding that one? You write your own things. Yeah. I'll give you your dialogue after this. You introduce yourself and you are asking something from the patient. So what will the patient speak? Right. The best presentation will get a nice gift today. So now let us start the discussion. Yes. So we have seen, you have written in your notebook, you have written type, everything is there. Now one by one I'll call in the same order. So Furatu. Hello Safuratu, now you can speak. You can tell how you introduce yourself, you tell in your own words. Come on. So here it is. Hello Safuratu, can you unmute? Safuratu, can you unmute? Okay, next. Next one, who is next one? Christopher. Okay, you can speak. Unmute.
Good morning. I'm Christopher, one of the registered nurse working in this hospital. How can I address you?
Very good. Next, Vinod Singh. Safuratu, you also have to speak like this. Once you finish speaking, you can mute all of you. Yeah. Vinod Singh. Vinod Singh.
Yes, sir.
Yeah, you can speak your sentence, how you will introduce. You have written, then you typed, now you can
Good
speak. You will
morning.
get habit.
My name is Vinod Singh. I am one of the registered nurse. And how can I help you? And could you tell me please your name? And yeah, or can you tell me your name, please?
Yeah, very good. Next, Smita.
Yes,
Safuratu,
sir.
next, you be ready. Vinod, you can mute yours. Audio. Yeah, Smita, you can start.
Good morning. My name is Smita and I'm one of the registered nurses working in this setting. How can I help you today? Could you please tell me your name for my documentation purpose?
Very good. Very good. Next, Safuratu. Yes. So Safuratu Al Hassan, you are busy, I think. Okay, fine, no problem. Next, come on. Now write down the patients. What will the patient speak? Now write down in your notebook. Afterwards, type. You can say, yeah, thank you very much, nurse, or something like that. I am Abraham Lincoln, or I am Margaret Thatcher. Whatever name you want to give, you can give. And you can say, I am 25 years old. I am an apprentice. I am an apprentice. And I have a problem. Okay. I feel I am very weak because of this disease, this is sickness. Okay. So whatever you want to say, you can say. So here, taking this part, I have visited the doctor. Okay. So now I am discussing with you the pre-operative, yeah. Whatever you want to say, you can say from this introductory background part. From this background part. Afterwards, 5 points you will speak. First, this background introduction, then 5 points, then conclusion. So we are in this background now. You are, yeah. My name is, thank you very much, nurse. I am Abraham Lincoln. I am an apprentice. I am 25 years old. I have this something called pilonidal sinus, and it is there for excision next week. They say excision is scheduled for next week. Okay, I have a lot of pain, but I am embarrassed. I have seen the doctor. Okay, right. I am discussing these things, whatever it is, whichever you feel important, that you take and right. I want to know more about these things, or whatever, whichever is suitable, take that one and make 4 or 5 sentences. All of you. Then based on that one only, next question will be, how do you feel now? What is going on? Do you have any concerns? Anything you can speak there. Take your time and write down. Yes, so we are developing the style here. And write 3 or 4 sentences. My name is Abraham Lincoln. Very good. Yeah, this is Christopher. Afterwards, we'll discuss these sentences also. This is for Christopher. Christopher is number. So Smita is this. So Christopher is here. Yeah, that is Christopher's sentence. Yeah. Yeah. Next, you can prepare your next sentence and you can practice. Make any improvements or anything like that. Yeah. Patient, how will the patient respond to your particular sentence? Yeah. Yeah. Yes, Smita. Very good. So this is Smita's. So patient will talk like this. Okay. Right. Okay. Come on, next. Very good. We'll discuss all these sentences, what type of grammar mistakes you are doing. Next, Safuratu. Yeah. Yes. Right. So we have all the three regular students have given the answers. What about the rest? If you want, you can do. Yeah. Now the patient has given the answer. Next, the nurse. Yeah. How will you respond to that? Your own question. You are writing in your notebook, na? Follow. Make it a dialogue there. Now respond to the patient now. Okay. Yes. So Smita. So good morning. You can call me Rose. Yeah, that is finished. Now Smita. Good morning. My name is Maria. I have been suffering from pilonidal sinus. Okay. Right. Yeah. Yes. So we'll do one thing. We'll take all these things together. Little confused now. Whose is what? Okay. Afterwards, I'll collect everything. Yes. So nurse, now how will you respond to your patient's questions? Yeah. After the lecture is finished, everything I'll copy it together and I'll separate. That is better. Yeah, good morning. I am Elisha. I have been suffering from pilonidal sinus. It is causing a lot of pain, but I don't want to take any painkillers. I am Lily. Yeah, Lily has joined here. Very good. Yes. Yeah. Write down. Yes, Christopher. Very good. Oh, that would be uncomfortable for you. Did you tried any control the discomfort and why don't want to take pain medication? So, no problem. That we can correct, na? Yeah. Then next, once that is done, then the patient's role. This is the patient's card again. So prepare well. Those who are doing all these things, they will be given a speaking session. Okay, those who are participating here, they will give a speaking session and with complete feedback. Yeah, this is next. So I'm so sorry to hear that. It must be painful. But did you take any pain relief medicine or any other treatment for that? Smita. Safurato. I'm really sorry to hear about that, Miss Rose. You seem anxious. Please relax. We are here to assist you in any way we can. I could see from your case note that you have been scheduled for surgery. Is that correct? Very good. Now this is, yeah, yeah. So write down now, nurse. Finished. Now patient. What will the patient say for that? Now the patient, I am very much embarrassed. I did not concentrate. I did not pay attention to the doctor. He was actually explaining it very well, but I was in tension. I was confused. I could not focus what he was telling. Okay. She explained what is a pilonidal sinus, but I could not get a clear picture. Can you please explain me? Can I still find out what is pilonidal sinus? Can you explain me again? Or can you make the doctor, can I make an appointment with the doctor so that I can listen to him? Either you can explain or she can explain, no problem. I want to know about it. Or do you have any brochure? So I can ask in any way you want. Yeah. So now we are going to have the next part. Now we have the next part now. Patient. What will the patient say? Write down your sentences. What will the patient say for that? Yeah. So we are in the second point. I'm very much embarrassed. I did not notice, I did not focus on what the doctor was telling. Okay, he was explaining me well, but I was, surprised, or I was confused. I did not get a clear picture. Can you please explain me further? Yeah, come on, write down. Yeah, two people have written. Very good. Yeah, Smita and Christopher. Next, could you please explain to me what is pilonidal sinus? I couldn't understand when the doctor was explaining to me because I was in pain and very nervous. Very good. Yes, nurse, I couldn't able to sit in my office and it's very embarrassing to me. Taking pain, medication seems to be weak in my point of view. Very good. Yeah. Yes. Next. So that is a patient talking. Next we have the nurse again. So how will you respond for that? Yeah. Yes, nurse, I couldn't able to sit in my office. Yeah. Don't be embarrassed like that. It's a common disorder, so don't worry about that. And do you know about your condition in detail? Yes, good. Come on, write down, nurse, all of you. So now we are moving into the third point afterwards. So this is what the patient said. The nurse. Pilonidal signs is actually a small opening, is a tract on the surface of the skin, predominantly caused by an ingrown hair, exacerbated by sweat and prolonged sitting. Now you will explain this in your own words. A pilonidal sinus or pilonidal sinus is a very small opening. It's common for many people. It's a common problem, so no need to worry. Actually, this is a small cyst. Actually, it's a tract on the surface of the skin, predominantly, mainly because of an ingrown hair or due to an ingrown hair. And this has exacerbated, okay, or intensified by sweat and continuously sitting. So that's the problem. Otherwise, there is not that much seriousness. This is quite common. So no need to worry. We can still manage and we can get everything perfect here. Nothing to worry. Whatever you want to speak, you can write. Sidra David, welcome. Hello Sidra, are you in the UK? Yeah. Come on, write down your next sentence. Yeah, I know you are from Pakistan, but are you already in UK or? Okay, you are in UK, fine. Okay. Yeah, write down the next. So third point, explain. Explain the third point. Right. So only two more points remaining. Welcome, Joy. Yeah. Write down the third point. Complete the third point. Then we'll go for the patient now. Now the patient will say, okay, I'm very clean. You see, I'm not dirty. I take bath regularly. Due to my work, I only shower in the morning and take bath at night. I'm very much careful about hygiene. I take necessary precautions. So there is no problem with me. So whatever you want to say, you can say. That is the third point of the patient. Write down. I'll give you this document afterwards. Sachin, Safuratu, then Smita, all the regular students. I want your document. Lily Begum. Yeah. Other guests, if you want to submit, you submit. We're going to discuss all your mistakes. I'll copy from here the chat box and I'll show you. We'll make a complete dialogue. And these you can take, others also, you can learn from others also. So yes, nurse, explain in detail. Okay. Yeah, very good. Pilonidal sinus is a small opening where it is caused because of ingrown hair, sweat, and unhygienic practices. Yeah, very good. Come on, others also. Nurse, I am very clean and shower every day. After my office, even I take a bath regularly. So I am wondering, how can I get this? But nurse, I am very hygiene. I am very hygiene. Clubber. And I take bath twice. Okay, good. Next, the fourth point. Ask what you, sorry, reassure the patient that you are not indicating that she is dirty. I don't mean, I did not mean that you were dirty or unclean. Okay, don't take me wrong, please. Maybe my words were misunderstood by you, or you misunderstood my words. That's not what I was telling you. I told in general that this is because of this, but I did not mean that you are. It happens. There are many reasons. Okay. So reassure the patient. There is no problem. I understand your concerns. I appreciate that you are very tidy and neat and following hygienic practices. But that is not everything. There are many points, there are many aspects why an individual can get this pilonidal sinus. I casually remarked that one. So, salt baths post-operatively will help facilitate healing. So, you can take salt baths on a regular basis. So, write down in your own style. Write down in your own style. Others, those who don't know, learn from the others. Copy and paste. Save in your mobile phone. Or I'll give the printout of this entire discussion in the form of dialogues. So no need to worry. Okay. Wow. Safurat. Yes, that's correct. Nurse, all right. Do you have any questions or concerns that needs to be addressed, patient? I have been having severe pains and I feel very weak because I'm taking too much painkillers. I perfectly understand your point. Would you mind telling me more about your pain on the pain scale, where 1 is the least pain and 10 is the worst pain? I will rate it 10. Nurse, I'm really sorry. That must be a lot of pain. I also feel embarrassed about my condition, especially when I'm in my office. Nurse, it is okay to feel embarrassed, but please don't worry. We are here to help you. Patient, the doctor said I am suffering from pilonidal sinus. Can you please elaborate on that for me? Nurse, okay. Miss Rose, pilonidal sinus is very common condition where there's small opening caused by ingrown nails. Yeah, Lily. Nurse, I like to talk about every operation before we need to save and clean and bathing. Okay, right. Now what next? Mr. Paul, don't take me wrong. You misunderstood. I know you follow hygienic practices and I appreciate that salt baths can relieve your pain. Try to keep and clean the affected, try to keep and clean the affected area. Try to clean the affected area and maintain it clean neatly. Okay, something. Fine. Dry. Try to keep dry and clean the affected area. Very good. Fine. Next, patient. Ask what you need to do after the procedure. So you'll ask the nurse. After the procedure, what am I supposed to do, nurse? So what are the measures that I have to take? Precautionary measures. What are the things that I have to follow? Can you explain me in detail? I'll make notes of it and I'll try to follow everything with sincerely. Yeah, yes, please. The next points. Only last 2 points we are left now. Yeah. Nurse, what am I supposed to do after the procedure? What are the various measures I have to take? What type of diet I have to eat? Or how can I make sure that this condition will not deteriorate? Or it should enhance or improve, faster recovery, or whatever you want to say. Use your own words. Think and write down. Patient, please. What am I supposed to do following the procedure? What are the measures that I have to take? I want to recover faster. So can you give me some suggestions which will speed up the recovery process? Yeah. So next one, nurse. Reassure the patient that you are not indicating, okay. So provide information on post-operative care, bleeding, signs of infection, importance of taking analgesia appropriately, use of antiseptic dressings. Last point. So here it is. There may be chances that bleeding occurs. There may be signs of infection. Okay, you have to take care of this. Whenever you have bleeding, so you have to follow these measures. Clean it properly, then afterwards dry up, and then apply some whatever suggestion given. Then put a band-aid so that the dust will not settle on that one, and keep it dry. There may be signs of infection. Regularly monitor, observe, check, examine yourself whether there are any signs of infection. This should be done on a regular basis. So it is very important. If there are any signs of infection, so you have to follow this procedure. Or if you are not able to manage the condition, you can call us or you can contact us. Yeah, Lily Begum. Yes. After operation, we stay in post-operative area, and also we follow up to you any complications and also monitoring your general conditions. Smita, wash the area daily with warm water and pat it dry. Pat it dry. Don't use hydrogen peroxide or alcohol, which can slow healing. You may cover the area with a bandage if it weeps or rubs. Weeps against clothing. Change the bandage every day. Hope you understand the point, Mr. Paul. Yeah. Yes, very good. Come on, whatever you are written, we'll take together. Yeah. So next point. Provide information of post-operative care, bleeding, signs of infection, importance of taking analgesia appropriately. It's extremely important that you take analgesia regularly as prescribed, and then you have to use antiseptic dressings also, whatever dressings have given. So you have to change the dressings on a daily basis. Right, Safuratu. Always keep the operated area clean, dry and covered. Very good, excellent Safura, you are doing very well. Observe the site for bleeding. For any signs of infection, try and eat nutritious diet to aid in quicker healing. Also report any abnormal changes in your body, your site, operated site clean. Okay, fine. Very good. Last sentence. Yeah, next nurse, patient. Reassure the nurse that you will follow the doctor, nursing staff's advice. I will definitely follow all your suggestions and recommendations, nurse. What are the doctor's orders or prescriptions? I will follow on a daily basis. I'll stick to the medication regime. I'll apply the, what is that? Dressing changes on a daily basis. And everything I'll do, whatever you have said, I'll try to do. And 99, 100% I'll try to do. To my level best, I'll try, because it's my health. And I'm very much concerned. I want to improve and I want to be normal. I don't want to prolong this condition of mine to exist as it is. So I will stick on, I will adhere to the medication regimen. I don't want to suffer pain. Why should I suffer pain? Better I follow your suggestions and recover soon. Yeah. So very good. It's important. It's really important to take painkillers to subside, not subsidies, to subside, SIDE. Subsidies means reduction. Okay, subsidy, gas or something, they reduce the fees, that is subsidy. Actually, the cost of gas cylinder is 1,800 and you are paying only 1,000. That means you are getting 800 less. That is called subsidy. Discount. That is called subsidy. You have written subsidies. That's not right. It should be subside. SUB, subside means go down the pain and check for any signs of infection like bleeding and pus in the operated area or high fever. In such case, you need to contact your GP. Very good. Yeah. Right. Yes. Last points. Come on. So next, a patient. So patient will say, yeah, I will follow the doctor's suggestions, nurse. Seriously, I don't want to suffer pain. Right, that's finished. Now, how do your conclusion? How do you conclude? Thank you very much for listening to me patiently and your readiness to listen and adhere or stick on. Thank you, nurse. I'll follow all your instructions. I'll take whatever precautionary measures you explain to me. Seriously, yeah. Come on. So what I will do is, okay, finished everyone. Then I will put this one so that we can make the notes. Then we can think about what are the mistakes you have done. I'm giving you another 3 minutes. Finish off with the conclusion part. Write down what you will say and what the nurses say and what the patients say. Yeah. So okay, that's fine. So I will take these notes and I'll send you everyone. So select all, copy. Yeah, I'm putting in the Telegram channel. You can download that one and you can make your dialogue and you can give me. Yeah. See you all later.